Group 7 here.
Hello, my name is Serena. My takeaways from the reading were that healthcare often focuses on acute problems, and we tend to sometimes overlook long-term suffering, and the reading really highlighted that suffering isn't just a single crisis. It's a daily and cumulative, and it's exhausting for the person dealing with it. And so as healthcare professionals, we should look at things that outsiders often tend to underestimate. And the author had stated and had expressed feelings of pressure to look okay even when she was not, and that kind of just shows how patients may hide symptoms to avoid judgment from other people, and that really affects assessment and trust between you and your patient. So just paying more mind to what your patient is going through and validating them and paying attention.
Piggybacking off that, in the text it said how her arthritis isn't necessarily a physical disability, or it is a physical disability, but you can't physically see it. And so she often had the thought of, do I show it to the world or do I keep it personal and private? Because she didn't want people to think she's being dramatic or faking it. And so I think she could have used spirituality or religion to ask for guidance from a higher being, and just reflecting on how she's feeling.
Kind of piggyback off what Kate and Serena said, as nurses, we spend the most time with our patient, so I think it's important to kind of build that connection where they feel safe and comfortable to talk about this pain, because she mentioned in her book, her pain might have been physical, but as a patient, they shouldn't have to defend the pain they're feeling. And as a nurse, I feel it's important for us to notice this and kind of help them and talk about them, and that can kind of go into their spirituality, and there's non-pharmacological ways of healing them.
Yeah, as for religion and spirituality and nursing, I think they definitely have a place, but only when it's something that the patient wants. It's really important that nurses don't try to push religion on patients that are unwilling. For some people, faith or spirituality is a big source of comfort, especially when dealing with long-term pain, chronic pain, and long-term illness. Nurses should support that if it matters. Just kidding. The focus should always be on what helps the patient cope and feel supported. This article reminded me that good nursing care is more than treating symptoms.
Kind of going off what some of the others have said, I think it's very insightful how this author is talking about her not very visible disabilities, but something that is very chronic and something that you aren't able to see. And I feel a lot of the times with our patients, we might not be able to see these problems that they're dealing with, so it might affect other things. And I think it's important that we take a step back and to look at the bigger picture, and to also understand their perspective, and as well as just everything else with it. Yeah.
Going off what Kira said, I liked reading about her point of view as being a patient with chronic arthritis, and knowing how she feels and what her story is. And I think us as nurses are the ones who are going to need to advocate for our patients, and hearing about her and her story was just really insightful and helped me know what to do and how to come up with interventions and implementations on how to care for our patients who are feeling the way that she is.
Going off of what they said, I think it's important to acknowledge how empowerment and vulnerability are important when we're taking care of our patients. Vulnerability was shown within the reading when she explained how arthritis impacted her, and she also mentioned some ways that she was able to find empowerment, the shoes that she wore at the wedding.
And kind of going back to advocacy, as the nurse, you may not know about every single religion or spirituality that a patient may want to practice, but I think a good nurse would go out of their way to learn what the patient wants and then educate themselves on how to provide that practice for them, especially if they are in the hospital long term, because we can't know everything, but building that relationship with our patient by doing that is going to build trust, and trust is the most important thing between patient and nurses.
I agree, and piggybacking off of that, also making sure to like collaborate with the nurses on your floor who may also be taking care of this patient, and just managing that communication between the patient, their family, the provider, and just making sure everyone's like in the loop about what the patient may need and what we can accommodate for them, and just making sure that we're grabbing all those resources for them and doing the most that we can.
Anyone else? Final thoughts?
Thanks.
Thank you.